Today we're going to talk about reticular spider veins of the posterior thigh and calf, how to diagnose the origin and how to treat them. Reticular and spider veins that involve the posterior thigh usually result from the vena jacqueminii or from a branch of the lateral reticular perforator. That is the origin of the pathology in the subdermal reticular plexus. Although other branches, such as a branch from a perforator, such as a gastrocnemius vessel, or a branch from the SSV, may also contribute to posterior thigh reticular and spider veins. However, these are usually located below the popliteal crease. Now, in this PowerPoint, multiple modalities will be discussed. You will see how we do sclerotherapy. You'll also see the technique of dilute foam injection. We always use dilute foam injection when doing these small reticular spider complexes. In this patient, we're using 0.25% polydocanol foam due to her history of asthma. For the liquid sclerotherapy, we're using 0.33%. Now, many times you see some reticular and spider complexes posteriorly. So today, we're going to just inject these. She has a history of asthma and inhaler use. So we're going to use 0.25% polydocanol foam. I'm going to inject all these. We use 27 gauge needles, sometimes a 30, we'll see. We'll start with a 27 gauge here. And then we're going to do an ultrasound after we do this, just to see where all this comes from. Yep. Now these are, I've injected this little reticular vein. You can see it going out into the spiders now. This is 0.25 foam. Foam at 0.25 works well for small veins. Okay. Now we're going to do sclerotherapy to some of the smaller vessels. Bend the needle about a 30-degree angle, and then you just go in parallel and cannulate the vein. You can see nice feeding out. Again, parallel. Remember, this is only about 1 millimeter deep. So you put a little bit of pressure on the plunger as you go in. You can see it fading out nicely. Up here, again. Now, we look around to see if there's any other small spiders that we can inject. And I'm going to put tumescent now underneath the larger complexes. So we'll do that in just a second. Now we're putting tumescent subdermally, just because we don't want this to refill. It's a little bit larger complex. We'll see if it clots up. Sometimes the vessels just oppose and you don't need to do anything else. Sometimes you need to flush them. Now we're going to do the ultrasound and see where everything came from. And this is from the lateral reticular perforator. Here it is right here. So we're going to look for that perforator. Make any reticular veins around it. Just inject more foam if we see one. But you can see here's the lateral reticular perforator that's causing all this. Now these are the reticular vein in the region of the lateral reticular perforator. We've got some reticular veins. We're going to inject this with 0.25 foam as well, and just to fill up the perforator a little bit more. Now you can see right here we've injected, there's a little tiny thrombus, a little tiny stick. Another one right here. So you get a much better cosmetic effect and resolution. You just get this out, like so. Look how much better it is already. Okay. Now, post-op, we use Dermica cream. and compression wrap for about 24 hours, sometimes 48. You can see in this patient there's some blotchy red areas where we did some of the injections. You do not see the reticular veins or the spider veins, but you see these little red blotchy marks. This is from solar elastosis. Now, solar elastosis is thinning of the reticular dermis. Sometimes there's hardly any dermis present. And also the skin is actually abnormal also, the squamous epithelium itself. Now, even though they have solar elastosis, they'll get a good result as long as you take care of this, you do some compression, use Dermica cream. They actually get a very good result, even though it takes a little bit longer to clear when they have all this skin damage. But I think this is an interesting point. You see something like this, just instruct them to use Dermica cream for about a week. You can actually have them wear compression as long as possible. Most people here in Florida, it's about a day or two and that's it. But these marks will resolve and she'll have a nice result. This is what it looks like when you treat a patient that's over the age of 65 or so, or has been in the sun for a long period of time. Now, in conclusion, injecting reticular spider complexes with dilute foam sclerotherapy allows treatment of the spider veins, the dermal perforator, reticular veins, and allows for determination of origin of the entire complex. Now, if you just use liquid sclerotherapy, you're not going to be taking care of the dermal perforator nor the reticular vein that actually feeds the complex. So, dilute foam sclerotherapy is very good for these large complexes. It also allows you to determine the origin of the pathology.